Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Natasha Iyer, Medical Director of Better, a medical center for complete living, an instructive mentor and teacher for integrative and anti-aging medicine. Thank you so much for joining us today, Dr. Iyer.
Thank you very much for having me.
So before we talk about your role as medical director in your clinic, Better, a medical center for complete living, can we talk about where you did your training, and that being your allopathic training?
I'm South African trained, and I studied multiple different disciplines in medicine before finding my home in rural and emergency medicine. Loved it, absolutely loved taking care of people and their families and being part of a community and being integrated. I did everything from ER to delivering babies to looking after them through their childhood and into their teens, looking after mom and grandma. And what intrigued me was how complex it is. And yet I was just looking at a single thing. And you could start to notice things that ran in families or little peculiarities, and medicine didn't actually explain that. Loved the adrenaline of the emergency room, still do. But through my own health challenges, I was burning out and couldn't find answers. You know, my tests were all normal. I was gaining weight, I was fatigued, I felt old. And I was just early into my 30s, and nothing could explain how rapidly I was aging on the inside and the outside. And I feel like sometimes in your own life things happen so that you get to help others through it. And that's what happened to me. You know, finding functional medicine helps me help people who otherwise have not found solutions to feel better. You know, as opposed to before, where I helped people not be sick, or I stopped an illness. I never helped them really be well again, whole again, complete again. You know, after a heart attack, for example, you're on so many different medications, or you put someone on an antidepressant and sure, they're not as miserable as they were before in how they functioned, but they're not well. You know, many people would say, I'm emotionally flat. I don't feel the same way. I don't have the same spectrum of emotions. And with functional medicine, we make people well again. They're whole. They're enjoying life in a way that they never could before. Even me, you know, in my 40s, I function far better than I did in my 20s and 30s. In my 40s, I can do a yoga class with 20-some-year-olds and am stronger and can do better than them, even though it's my first time. So it's amazing to me that we have this capacity to practice a type of medicine that completely restores wellness, vitality, and health to a level that in my old practice I never could before.
So when you weren't feeling well and you reached out to other allopathic physicians and your colleagues in the community, did they have any answers at all for you?
None. In fact, I had had an autoimmune thyroid disease. I'd had my thyroid ablated, so killed off. And I was on thyroid medicines, and I had every single symptom of low thyroid. But my tests were all normal. So there was no explanation. It was a sort of, maybe you're depressed, maybe you should take an antidepressant. You know, I was cold all the time. My hair was falling out. I was gaining weight uncontrollably, regardless of how much exercise and diet and all of those things that I did. I was getting things like asthma. I didn't have it as a child, you know, bronchitis frequently. I was getting migraine headaches up to 15 a month. I had body pain from the top of my head down to my toes, and there was no answer, because any test we did, everything was normal.
So where did you ultimately find the help that you needed?
it came through a patient who introduced me to bioidentical hormones. She came asking for it, and she gave me a book to read about hormones. Now, in South Africa, we have a fairly thorough, actually a very comprehensive medical school undergrad program. You know, you have 2 degrees, a degree in Bachelor of Medicine and a Bachelor of Surgery. We get a lot of clinical experience. And I thought I was knowledgeable. I've even done postgraduate residency in obstetrics and gynecology in Canada, experienced with women's hormones and replacing them. And what I read was completely different. It was completely unknown to me. You know, it was how I was trained was, you have symptoms of menopause, here's your hormones. If it doesn't work, double it. If that doesn't work, double it again. If that doesn't work, well, let's give you an antidepressant and wish you well. And if you have a uterus, we'll protect it. And if you don't, then, well, we don't need to do anything about it. So there was no talk about progesterone being a neurosteroid. There was no talk about replacing testosterone as part of this whole spectrum of proper balanced hormone replacement. There was no talk of measuring, testing, and then treating. There was none of that. We wrote prescriptions in the women's menopause clinic, and I was training to be a specialist in women's health. So, you know, I was reading this book and I thought, my goodness, what is this all about? Because I thought I knew a lot. I had done postgraduate obstetrics and gynecology in South Africa as well. So I've got both sides. And then there was all this hypothalamo-pituitary adrenal axis, or back then it was called adrenal fatigue, and looking at your life-sustaining hormones in balance with your feel-good hormones. And my brain felt like it was exploding because it all made sense. And so I started out with A4M and functional medicine training. And initially my focus was on bioidentical hormones and women's health and balancing hormones. It evolved into a very keen interest in metabolic medicine because of my own challenges with my weight. You know, the exercising 2 to 3 times a day, counting calories, nothing was working. And so I've really stayed focused on how to improve and restore metabolism in everyone, let alone as you age. And from there you learn all the pieces of the puzzle must fit together or you can't fix anything. So the journey into functional medicine and restorative medicine has led me to say this to everyone. There's no one thing that explains everything. And patients are so good at coming to me and saying, I read this on the internet and this is what I want, or it has to be that, doc. This is what I read, and then I looked on your website and it looks like you can help me. And people cotton on to that one thing because they're so desperate for answers. And I know that myself. You know, when you're gaining weight and you're trying everything you know how to do, it's frustrating, but it's scary as well, because then you think, what is wrong with me? And so someone comes out with a book, or you know, someone's on TV talking about something, you go, that's me. That is me. It has to be that thing. And so what I love about our practice and our whole facility and the team that I created at our clinic is that we look at all of the pieces of the puzzle, because there is no one thing that solves everything. And it's about how everything fits together and it's all connected. So I say to patients, everything's connected to everything else. And so we have to look at everything. And that's the beauty of functional medicine, looking at the person as a whole, complete being. Never mind from how you sleep and how you think, but from what happened in your childhood and all of your exposures, and what's that tipping point for you. You know, what sent you over the edge that you showed up at my door saying, help, nothing works and I'm desperate. You know, we look at adverse childhood events. We look at how your mind can work for you or against you. We look at food as medicine. And I think that is, you know, it's so common to say, but I still don't think people get it, because they're looking at the ketogenic diet or the paleo diet or the fasting mimicking diet or intermittent fasting, and Why is that not working? Well, because that's one piece of the puzzle. You know, until we look at everything, we're not going to fix it all. And so in functional medicine, it's always finding all the different pieces, and they're different for everyone. So you have to customize and personalize that approach for that individual patient to get them the results that they're looking for. And that's what's so exciting about it.
I imagine that your typical office visit is quite different than what patients were previously accustomed to. So how do your patients respond to this type of approach?
The most common thing I hear in my office after the first visit, because I ask patients, how was it? Is there anything missing for you? Did you feel, you know, like something was missed through this process? And almost everyone says, I feel so hopeful. You know, for the first time, I feel like someone's listening to me, I'm heard. And 90% of healing comes from that interaction and that relationship with the patient, because I tell my patients this all the time, I really don't do a whole lot. You get to do it all. You know, I don't get to go home with you. So you're doing the work. You know, the results that you're getting are only because, one, I coached you, but 90% of it is what you do at home once you leave the office. And so when they're getting results, and you know, they go from feeling awful and like they're dying, or they're worried about what could be, you know, what's going on because no one can help them, to, you know, 3 to 6 weeks later, they have this dramatic change in how they're feeling. It's amazing for people. It was really interesting. I had this lady come to my office last week, and I said, so how did you hear about me? And she said, I heard from a coworker. And I said, oh, who's that? And she said, no, she's never seen you before. I said, so how did you hear about me from a coworker? And she said, her friend was on the floor, depressed and unable to work and unable to function, and you helped her get back to her normal functioning. And so she told me to come see you because that was what you're capable of doing. And it was amazing, because you don't realize the impact. And I've always said this to patients. When I help you, I'm not just helping you. I'm helping your entire world, like everybody that's connected to you, whether it's your work or your home or your social circle or your church group, because how you feel and how it affects how you interact with people and who you are and how you show up in your life and in your world. And so feeling your best makes such a difference to everyone. So it's you know, in functional medicine, we're not just helping one person, we're helping a community.
That has to be incredibly gratifying.
It is. It is truly. I wanted to be a doctor since I was 11. And that's all I ever wanted to do with my life. And it was one of the disenchanting things that I experienced through my first 11, 12 years in medicine, where I kept feeling like something was missing. You know, I would see a patient and say, your tests are all normal. Exactly what I was told. And at that time, I didn't know how it would feel until I felt it. But I remember thinking, this person has sat in my waiting room, sometimes an hour or two. You know, if I was out delivering a baby or getting called out to the ER and then I come back to my office, people waiting 3 hours sometimes. But they wait. And it doesn't matter whether you're the CEO of a company, a mom, a teacher, a doctor, a lawyer. It doesn't matter who you are. We all have 24 hours in a day. And if you give 3 of those hours to sit in my waiting room, and then you come back again and you say, something's still wrong, doc, and then you come back again, and all I have for you is your tests are all normal, I began to feel that there were things I didn't know. And I remember little clues. I had one patient, and I graduated at 23, and so I remember being 29 and sitting there looking at this lady, and in your 20s you think everyone who's 50 is old. Not anymore, but back then, you know, you think, oh, that's old. And this lady was a 50-year-old marathon runner. and she looked great. She was in great shape, and there were a lot of women who exercised at her age, but she just looked better than everyone else. And I remember asking her one day, I said, you know, how is it that you do all this running, and most people after years of running start to have poorer recovery time, they start to have some tear down, you know, and in functional medicine now we talk about build up and repair versus wearing down and tearing down, that whole catabolic anabolic balance. And she said to me, I take coenzyme Q10. And I thought to myself, what on earth is that? Just a regular doctor, right? And with no disrespect, because we need all facets of medicine. But I used to be that doctor that had that ego and that attitude, and I'd think, well, if I didn't learn about it in medical school, then, you know, it's probably not worth looking at further. And now that I do functional medicine, I remember her, because I think, coenzyme Q10, imagine that. You know, so much learning and little pearls from patients.
So there seems like there is so much to know, and the science is always evolving. So many physicians that we have interviewed have expressed a frustration in, you know, the way that they were taught to practice, and ultimately that made them seek, you know, the alternative options. And when they were introduced to functional medicine or anti-aging medicine, the light bulb just went off, and it reignited their passion to practice medicine.
The science changes so rapidly that staying committed to continuing education and updating, and that's why I think these meetings are so valuable. I will retake certain courses and modules that are interesting to my specialty because everything evolves so rapidly. And I tell my patients this, what I told you 6 months ago is different from what I'm telling you today, or I'm adding on to what I told you. And it's not because I didn't know what I was talking about, but I'm keeping up with the science, and as it evolves, my practice with you has to evolve, and how we do things with our patients have to evolve. So I believe that in this field, you cannot just stay stagnant. It's just ever evolving, and that's what keeps it so exciting. You know, for someone like me who's a lifelong learner and I'm addicted to new things, I just love that. And then what it does is at our clinic, you know, my tagline for patients is, I help you feel, look, and live younger. And when you're doing restorative medicine, you just naturally start to glow. Your skin naturally regenerates younger and healthier. We do have a full skincare component to our clinic for those people who want to take it to the next level. And functional medicine helps me keep it so natural and cutting edge, and we can get better results that last longer. We can get synergy out of treatments that are completely natural yet rejuvenating. And I think that is also a really exciting part of what I do, and it just makes me so happy every day to do what I do.
That's wonderful. Are there any specific modalities that you utilize in your practice that you would like to highlight?
One is the first thing in our team is our focus on that. So it's a one-stop shop for total care. So we do everything from meditation and life coaching to functional nutrition and naturopathic medicine, traditional Chinese medicine. So I love having those team members to support the work that I do, and patients can get the all the different facets taken care of. One of my favorite treatments that I love doing is PRP, platelet-rich plasma, for rejuvenation, because we can do it on joints and tendons and ligaments and chronic poor healing and pain, and it all goes away. And then you can put it in the scalp and make someone's hair grow back, because I have found, and when hair loss bothers people, it becomes a very real and big focus for them. Or many people, men included, when they don't feel like they look well in the mirror, or they feel like they look older, and I've been there. You know, I was 31 years old looking like I was approaching 50, and I felt like it on the inside too. And I say to patients, you know, once I felt better, if I continued to age from there, I'd still be looking older than I am, and no one wants that. So using PRP as a natural therapy, using gene-altering therapies to restore the, you know, or to turn on the youth gene in skin cells, you know, that's pretty cool when you can keep it so natural for patients and just help them get their vitality back. I mean, I wear no makeup, and I get complimented often on my skin. And I tell patients it's 90% from the inside, and then 10% of a few tweaks on the outside, and there you go. So it's that combination of inner health, outer beauty, looking at skin renewal. I think I would say that's my favorite thing, to help them on the inside and then help them on the outside, and put it together in a way that I don't know too many people are doing, where we're using nutraceuticals and cosmeceuticals and cutting-edge natural technologies, in addition to some old school traditional things, but we can keep it completely natural and make people really happy, because it restores confidence. You know, when someone looks in the mirror and they're happy with how they look, it's a different level of confidence. And I found that very interesting. You know, when I started, I had this big thing about you shouldn't be looking at regenerating your skin first. You should always do it on the inside and feel healthy and be healthy. And the big learning for me was patients who would go seek treatments regardless, and come back with side effects or asymmetries, or just not looking as natural and normal as they could. And then they'd say to me, you didn't want to help me, but I needed to look younger first, because I couldn't stand stepping out the house and looking tired. I don't want people saying, you look so tired, or what's wrong, or are you sick? And that's when it dawned on me that we needed that full comprehensive skincare center within our clinic, because people get so much more sick when they're having that extra stress from being told how bad they look. And so now I'm more open-minded to helping patients start where they're comfortable, and then at some point create that nice process so that they can feel, look, and live younger.
That's wonderful. So it is my understanding that you're also a teacher at medical school.
Well, first it started out by default. When I was in my rural and family practice, we were a teaching clinic, and we would preceptor residents in rural and family medicine. And then when I moved into Calgary, I wanted to remain a little bit in touch with hospital medicine, and I worked in pulmonary, and then settled into first helping international medical grads learn more about our healthcare system, and help them in that preliminary stage where they could get into a residency and training program to get certified to work in Canada. That was really rewarding, to be able to help someone who's devoted and dedicated their life to medicine come into a country and find that, no, I can't practice, but here's an option. And it's very time consuming to preceptor. So this is not a paid position, so you're helping someone because you want them to do that. So I did that for quite a few years, and we have a few successful residency positions out of that. That was great. And now I help at the University of Alberta family medicine residency program, teaching procedural skills to residents. And why I enjoy that is I've always had a passion for surgery, and I've spent a lot of time in South Africa. You can do medical officer position, so you don't have to be a resident. You can work in that specialty as a resident without having to complete your residency, and you can stay there for years and progress through the levels and become very experienced. And I've loved surgery all along. So it's great that I can still do that and make a contribution. And then at the same time, when someone says, so what do you do in the rest of your practice? And it helps to have a young doctor open their mind to functional medicine, because our patients are doing it anyway, whether we're open to it or not. You know, my patients were taking CoQ10 and eating garlic and taking fish oils long before I even knew it was relevant, valid, or even studied. You know, I was busy writing statin drugs and anti-diabetic medicines, and many patients were doing things on their own. Most of them wouldn't tell me. Now imagine how much more useful it would have been to their care plan and our trust and our relationship had they been comfortable to tell me, had I been open-minded to it. So to me, it's really important that I inspire and influence doctors to not have to know anything about functional medicine, but to understand that it works, it can make an enormous difference to people's lives, and to not judge their patients because they're going to do it anyway. And times are changing. You know, I met with a resident recently who was quite aware of the role of food. But you know, you flip that to a patient who goes to an oncologist and says, you know, I heard that sugar and insulin are bad for cancer, and the oncologist says, no, that's fine. You don't have to worry about that. Just take your chemotherapy and we'll see you next time. And so you have this, thankfully, a new generation of doctors who are becoming more aware that food is medicine. And I might not know what food is good for you, but at least there are places you can go that are safe. You know, we study, we look at the data, we look at the literature. We're not someone just reading off the internet advising patients what to do. So I think it's really important that not only patients but doctors understand that functional medicine is not just something anyone can practice. You should be up to date in the science. You should be well educated and certified in the field. You know, today we were hearing about a patient, and I see this all the time. They come to me on hormones, and they still have all of these side effects and symptoms as if they're not even on treatment, and it's because they're overdosed or something was missed in that piece of the puzzle I've been talking about. And in functional medicine, we have a very organized approach and a step-by-step approach to helping patients rebalance and restore their health. So it's not just, oh, here, let's throw a vitamin at you, and oh, this hormone is bioidentical and it's supposed to be safe, so let's just give you some of that. And there's no willy-nilly approach. It's very safe, it's very well studied. And as always, go to someone who's well educated and certified in the field so that you know you're going to get the best outcome.
Well, thank you so much for sharing your personal and professional story with us today, Dr. Iyer.
Thank you for having me.